Hi, Juana. Welcome back. Good to see you again. All right. I got to look through your x-rays and your scans. And I'm going to start off by saying, unfortunately, you have some subluxation and some degeneration. So some of your stuff has been chronic. It's been there for quite some time. Some of it's more recent. But the good news is this is what I'm best in the world at. This is what we take care of every single day inside of our practice. So let me show you what's going on, and then I'll give you some recommendations. So as far as x-rays here, this is your biggest culprit. This is where we see some degeneration. So you have 3 segments that are really good. They're not moving great, so that tells me it's more recent. But right here where we see this degeneration, that's why you're having the numbness and tingling down your arm. That's also why you're having that up under your shoulder blade as well. So we have to get some motion back. We have to recapture and recover some of that movement in order to recapture some of your function. Your low back, we're looking for a straight spine, level pelvis, and you can see, we have some torque in your pelvis. This side's higher, this side's lower. We also see some degeneration between L5 and S1, and we need to get some motion there. So those 2 have also been there for quite some time, chronic. Now, what we look for as far as motion, we look for them, if you bend to your right, they should move to the right. If you bend to your left, they should move to the left. And so we can see here that that's not happening for you. They're not moving at all. And then when you go to your left, you did great. So this is kind of what you should see. So what are we going to be doing? We're going to be moving these to the right, getting some motion back. It's no surprise you did light up. You lit up a lot on your thermography in your lower back and a lot in your neck. This is kind of normal. You'll see some blood flow along your spinal cord, but this is definitely abnormal. Does that make sense?
Yes, it does.
Why it's inflamed. And then we can see here that we have that degeneration that's irritating the nerves. That's why you're feeling it down your leg and your sciatica, and that's also why you're feeling it up into your shoulder blade and down your arm. This other one, this does not show us pain. It does not show us inflammation. It shows us how the muscles are firing. We're looking for symmetry and balance. We have some dormancy through your low back. So it just means your low back is kind of shut down. But then we see a lot of just irritation and nerves being inhibited right here. So a lot of muscle spasm, especially right there where we see that degeneration back in your neck. But like I said, the good news is we can move it. We can help you. They're not fused together. If they're not fused, I can move them. Any questions about your scans or your x-rays?
No, you explained it all.
Perfect. As far as recommendations, it's going to take you, we do 1 month, 2 month, 3 month, 4 month. I gave you 2 months, so 8 weeks. Any questions there?
No.
So we're going to move it and move it. There's a progression to this, and the frequency is 3 times a week. So we're going to move it. What we get today won't be what we get tomorrow. Okay. I also have built into your game plan 2 progress exams, or 1 in the end and 1 in the middle. So we'll redo this. Okay. Do you understand why we do that?
So we keep track of progress.
Absolutely. We do not want to get to the end of this and be like, hey, how are you doing? We want to make sure that you're doing well within. In fact, that is usually always the case. You should expect some results well before, hopefully even the halfway point. And so we're going to check in with you every single visit, but then we'll do another progress exam. We'll sit back down with you and discuss how you're doing. We're going to go back through all the things that you told us and see exactly where you're at. As far as adjustments go, we move you by hand. You'll hear it move. You'll feel it move. The number 1 question I ask is, does it hurt? And I like to address that now so it's not an excuse later. The adjustment itself never usually ever hurts. Could you be sore tomorrow? Yeah, perhaps. Some of the stuff hasn't moved in quite some time, a long time in your case. And so as a result of that, sometimes you'll have just residual kind of muscle soreness like you worked out. But it should be nothing that you can't handle. As far as financials and scheduling, our girls do that. Tanya will be in here. There's lots of different options. There's an option to save a little bit, pay it in full. There's also options to break it up. You can decide what's best for you. Scheduling, we also let you dictate your own schedule. We're here from 8 to 12 and then 3 to 6. And so find something that works out well for you. If you have any questions, just feel free to ask. And she's going to step in. She'll do your schedule. She'll do your financials. And then she'll bring you back, and I'll have a table ready for you.
Sounds good.
Good. I'll see you in just a few.
Okay.